Hi everybody, Dr. Cary Yurkiw here, and today I'm talking about sleep posture and what are the best positions for sleep. Now, generally what I tell people is getting a firm mattress is best. You don't want too soft of a mattress because then it'll cause a sag like this, and it'll allow the heavier body parts to sag into the mattress. Then it distorts the spine, so we don't want that, especially if somebody has spinal problems already. So what I generally tell people is to sleep on their back with a pillow or two under their knees and a fairly thin pillow for their neck. A pillow that has a bit of a contour on it to support the neck, like a little rounding part for the neck area is good, and I'll show you why in a second. But having some support for the neck, having a couple pillows or one pillow underneath the knees just takes the pressure off the low back. And this is a neutral spine position where you see that red line, that dashed line straight. That's what we want. I don't like to see people with their head propped up too high because it does cause a kink in the lower part of the neck, stressing that area out. And if there's no pillow, sometimes it causes the low back where it meets into the hip area to get overworked. Lying on your side is okay, like this, with a pillow or two to bridge the gap between the mattress and the neck area. So what you want to do is fill in that space right here between the shoulder and the neck. So you want enough height to support the head and the neck without the neck sagging down or going up too high. And this is a good example right here of how the spine's in a neutral position. The pillow is supporting the head and the neck area, so perfect. We don't want the pillow too low, causing this. We don't want the pillow too high, causing something like this here at the top. Sleeping on your stomach is not a good position, so I'll go against what this diagram is showing. Sleeping on your stomach with your head twisted. I find too many people with neck problems sleeping on their stomach with their head twisted, and it can jam the middle part of the spine or the thoracic area. So don't sleep on your stomach at all. I would change this green check mark to a red one, but this is a diagram that I was able to get off Adobe stock image. So don't do this one for sure, but the other ones that I showed you are good. This one right here, this one's good, and then this is a zoom or a close-up of good posture right here. Now there's a couple exceptions. If you have shoulder pain, it's not good to sleep on that shoulder. So in this example, if you had left shoulder pain, the best thing to do is sleep on the other side, the right side, because in the ball and socket, the shoulder will get squished and it'll pinch the nerve and the tendons and the tissues further. So you'll wake up during the night or in the morning with a very painful shoulder. So stay off that side. Similarly, if you have a sore hip and it's on the left side, don't sleep on your left, but sleep on the right-hand side. That'll just help to take the pressure off that hip. And that generally goes for anything. Sore knee, ankle, ribs. Basically sleep on the opposite side or on your back because it's going to take the pressure and the load off that joint, allowing it to heal during the night. Now, I mentioned earlier the spine and the skeleton. So what you need to do is support this shallow curvature in the neck. So you do need something to prop up the neck area right here. So a small pillow with a rounded contour is very good. The distance between the back of the head and the peak of the back isn't that great, so you don't need too big of a pillow, but a shallower pillow for the head is okay. But you need something to push up on the neck right here to support that. Now, if the person has neck issues, misalignments, and poor posture in the neck, that pillow or setup may not work for them. So talking to your chiropractor, or if you're a patient of mine, me, about the right pillow setup for your particular neck is going to be important because we want a good custom fit for your neck and your condition. Similarly, some people have curvatures of their spine's twisted. So sleeping on one side might be better than the other for someone with like a scoliosis or a curvature of their spine. Or if your back's rounding too much, you have a kyphosis, different sleep postures, like a couple extra pillows here, maybe a pillow, an extra pillow in the lower part of your spine or the underneath the knees might help take the pressure off the thoracic area, because we don't want you to wake up with a stiff and locked up back in that area because you have too much rounding and now you're sleeping on your back. So there are some exceptions to good sleep posture, and it's all based on the individual and their specific health condition. If you're in the Kelowna area and you're looking for a chiropractor, we are accepting new patients. You can call the number below, or you can click on the link in our bio or the show notes. Please like this video and subscribe to our channel at YouTube. We're gaining subscribers rapidly. We definitely want to continue, so liking the video and subscribing does help our channel. And if you have any questions, feel free to comment or DM me. I'd be happy to help you. And I look forward to talking to you guys soon.